Okay, hello and welcome to a new episode of Empower MEN1 podcast. Today I have with me Justin. Hi, Justin.
Hi.
Super cool to have you on. And I'm really excited to hear about your experience with MEN1 and everything that your health journey has kind of led you to so far. So for a bit of background, Justin and I connected pretty recently over one of the patient Facebook groups to do with MEN1, and there was a kind of connection that I felt with Justin in terms of his handling of the condition and his mindset towards it, and I thought it was very empowering. And so that's why I wanted to get him on to share here with you today. So I hope this makes for a good listen. So, Justin, I'm going to start off by asking you, please, to just talk us through your story with MEN1 in as much or as little detail as you like.
Sure. And my gosh, it's hard to know sort of where to begin with that, right? Because it can start with a family member before you even realize that you have it yourself. And that's sort of how I got thrown into it. So really it started, gosh, I was probably somewhere around 8 years old when I just started to get the ballpark idea of comprehending not even really what it was, but that my grandmother had this condition. She had something that had eventually manifested into cancer. I always remember her being in and out of care facilities because of this. Um, Eventually, cancer did end up taking her life. Unfortunately, they may have acted just a little bit too long after, but she had passed it on to my father, who when did I was probably around the age of 10 when he sort of found out what this was and that it could be a hereditary thing. And um, I think I was around the age of 17, and he got a diagnosis. He didn't find out until he was well into his 40s. And so, you go for that long without knowing that you have a condition, and a lot of different things can happen. So he's been living with cancer now for close to 10 years. They're managing it very well. Um, but I remember I was around that age of 17 when we found out that this is what was going on with him. This is what we found. It's because of this hereditary genetic disorder called MEN1. Um, that was about the time when the doctors started saying, we should probably get your kids involved with this. Why don't we start getting them tested? And my calcium came back super high. It was close to 12. I think it was 11.6 or 11.7. And that's typically one of the first indicators that they will give you, especially if you have a family history. If you come back with a super high calcium level, or among other things, there's a ton of different things to look at there. So I remember thinking at first it's hard to get into any sort of positive mindset. Um, and it's almost natural to fall into a mentality of, is this what I have to look forward to for the rest of my life? What I saw other people go through that are in my family, that are super close to me. Fortunately, they found out when I was super young. They found out super early. So from there, symptoms that come with that are not, they don't make things super easy for day-to-day life all the time. With high calcium, it's a lot of fatigue. It's a lot of aching. It can be painful sometimes with your joints, with your muscles, feeling tired, low energy. I don't know if you had experienced anything like that previously, but it can be a battle getting up and doing things, doing your everyday routine. So I didn't end up having surgery. I had a parathyroidectomy when I was 18, close to a year later. They took out, I'm trying to remember because they implanted one in my forearm. And the reason they do that is to, if your calcium comes back high again, they don't have to go back into your neck. They can go into your forearm, take that piece out because they still want your body to be creating that calcium. You don't necessarily want to be dependent on medicine if you don't have to be. But it was almost instant relief of all of the things that I had been feeling. Because I remember when they found that out, it was like all of a sudden I had doctors taking something super seriously. I was getting MRIs, I was getting CAT scans, I was getting routine blood work, I had an endoscopy, which essentially is having a colonoscopy and a scope. I remember thinking like think I'm too young for all this to be going on. um, so it's quite the journey.
That is quite the journey. It's very interesting, actually. I try not to butt in normally, but when you started explaining about your family history and the
Sure.
dates and when times were coming back, I was like, wow, that is almost parallel exactly with what happened with my family. Um, and when your father was diagnosed and before you necessarily started having problems, how did that affect you emotionally, mentally?
It was pretty overwhelming. My other grandmother, who's not related to the MEN1 situation, she had just been diagnosed with um, cancer. It's hard to remember exactly whether she was 2 months before or 2 months after my dad, but they were very close together, diagnosed with these things, and it was incredibly overwhelming. I'm in high school at this point. I don't necessarily know why I'm feeling the way that I'm feeling physically. So being fatigued, feeling tired, having symptoms of um, different GI symptoms, different all these things, losing weight. There's so much that comes into that, and then to have these other things in immediate family going on at the same time, it's overwhelming. It can be for sure, especially at that age. Uh, it can be hard to try and self-regulate the way that you're feeling. You're still developing things like that. But he went through multiple surgeries. He had his parathyroids out. I think that may have been his first surgery. Was the parathyroidectomy. Our surgeries were a little bit different. I had my thymus taken out as well, which that's a whole nother level of something else. I remember him telling me before I had surgery, he's like, it's a breeze. You'll wake up, it'll be fine. There's no pain involved. And I remember waking up and I was like, I can't swallow or talk or breathe without squeezing my eyes because I felt so much pain. And they were like, well, it's because we took your thymus. And so that is quite a bit lower than your parathyroid. So they had to go with the same incision down farther to get those out. And so I was like, okay, that's kind of what happened. Um, so it's an incredibly um, interesting thing to deal with, even, not thinking about yourself having to have the same genetic disorder, the same issues, things like that. Um, did you have family history? Is that how you sort of came about finding out about yourself as well?
Yeah, I did. Almost identical situation to
Yeah,
yours with it starting off with my grandmother, my paternal grandmother. My dad had symptoms, but not till his 40s,
sure.
and really, really badly. And then that's when they discovered the gene in the family. Actually, his sister passed away very sadly from the condition. So and that's kind of when they found the gene, and my dad's problems were around the same time, and then they linked it back to their mother. So the stories are almost parallel. And then with
Right.
myself and my siblings, we were tested all around the same age, kind of like very early teens or sort of 10, 11. So there's
Yeah.
a lot of parallels. And I was wondering, um, you said earlier, when you had those awful symptoms with the hypercalcemia, and it was a battle, just to get out of bed. what was it that made you get out of bed? Because it could have been so easy to not do that and to spiral.
At that age, it was because I knew that I had to be totally honest. At this point, I'm going to jump fast forward a little bit to now from then. So that's almost 10 years. It's kind of crazy to think about now that I'm saying it out loud. But my calcium has kind of creeped back up to the mid 11s, upper 11s. And so I definitely have my days, even now, where I wake up and it's, you can feel fatigued. You can feel like it's going to be a day that you're just going to drag and you're going to have to deal with it. But choosing your attitude, it sounds silly maybe to some people, but if you do it long enough, if you do it consistently enough, um, it really does make a big difference. Um, there really isn't much that you can do physically to get rid of feeling the fatigue. It's almost like I describe it as feeling like your head is in a cloud. And it's not that you're tired, it's that you feel like there's something that has come over you and it's so hard to explain, but um eventually it passes and um every time it'll pass every time as long as you start your day. It can be difficult, but when I wake up feeling that way, it's not every day, it's a couple times a week at this point. um I just will myself to get up, get out of bed, get started. um think about being grateful that I have another day to get up and do things when there's a lot of people who have it a lot worse off than I do. um and not necessarily to compare situations, but it does help. I always tell myself you know, instead of today it could be better, my life could be better, I tell myself it could always be worse. So do what you can now, enjoy what you can now. It ends up going away within a few hours. But it's difficult for sure.
Absolutely. It's like that acceptance of what is, and not denying that. But at
And
the same
acceptance is a
time,
great word because that's really what it is, because you know what's going on, you know why you're feeling the way that you're feeling. And when you can accept that, um, you have so much more power over your life to will yourself away from having any sort of victim mentality, if that makes sense.
completely, I like to think of it as, choosing where I put my attention and my focus. And if it is on the difficulty, then that's where I'm going to stay, emotionally as well.
Exactly. It's hard to pull yourself out of it. It's and especially because it happens to most of us when we initially are waking up. Um it's I have found personally it's always so much harder to have a good day or a positive day when you're starting it out on a bad note rather than starting it on a good note and having other things happen throughout the day that kind of bring it down. It's so much easier to build up to that than it is to start at the top and come down. So, doing everything you can to um, progress your day, wake up, whether it's, I don't know, some people wake up and they exercise. I like to exercise in the evening because I'm not a morning person, even on my really good days. Um, but there's always something that you can think of to start your day off on a positive note. And it does help.
Definitely.
It really does.
Yeah, I can definitely testify to that as well. I have that as a practice now, like a daily practice for the past 2 or 3 years, and it just makes the most extraordinary difference, the way how you start your day. You mentioned about, your calcium creeping back up again. And I wondered, I don't know whether you're at this stage, or whether this is the case for you, but um, there's a sense in MEN1, I think, often where it's like, you're kind of, because it's not so aggressive that, you know, endocrinologists are coming in and telling you, you absolutely must have surgery, or you absolutely must do this, must do that. Otherwise, it's a case of life or death. They're telling you these are the options, you know, and it's kind of up to you to choose as and when. You know, you mentioned about already having your parathyroids out, and now the calcium's creeping back up again. And obviously, we know there are other glands and organs affected, you know, and that will always be putting us in a constant state of like, what do I choose? Like, what is the best option for me? And I'm definitely, that's something that I'm dealing with at the moment, is like, okay, you know, my calcium's up as well, and I've had no parathyroids out, but I have no symptoms. So like, when do I do it? Like, what, you know, do I do it? It's a tricky balance. Like, what do you find helps in that situation if you're, you know, if you're having to kind of toss up, okay, it's maybe I know this might have to happen at some point, but also I'm trying to live, you know, with what is going on. How do you strike that balance?
That's a difficult one. In my situation, I've spoken to my endocrinologist about it a few times, where, you know, I can see the numbers coming back up slowly, but they're certainly coming back up, and I have, it seems, more and more days of waking up and feeling like you're stuck in a cloud, and it's not being tired, it's being just fatigued for absolutely no reason. And it's, how do you strike the balance of knowing what to do? Um, it's tough because some providers will give you suggestions, as a lot of times they do. My endocrinologist has sort of left it up to me, to decide whether I want to pursue a surgical option or not. Um, at this point, I've elected not to. I do have an appointment coming up at the University of Michigan to discuss that with a um, a surgeon, to see sort of what my options are there, because there's, I think I have 1.5 parathyroids out of 4 left. But when they do leave those parathyroids, um, correct me if I'm wrong, but they do tend to grow back over time. And so that calcium starts to overproduce again. Um, striking the balance is hard. I'm at a stage in my life where I don't know what is going to be best for me. Do I do it again and have the rest of them taken out? But that also comes with thinking, am I going to have to be on a supplement for the rest of my life if they take too much? Or does it not matter because it's going to be worth not waking up with having these symptoms anymore? So honestly, at that point, I give a lot of my worry to my faith, and I lean on that quite a bit. Um, so at this point, I haven't made a decision exactly. I have an appointment coming up just to get an opinion from a surgeon. My endocrinologist has kind of left it up to me. He doesn't think I'm doing the wrong thing either way at this point, at this stage. Um, so I'm just getting another opinion to see where that'll take me.
I love that. I think just in explaining what you've explained, you've shown that sometimes it's not even really a case about thinking how you're doing something. It's doing it, and, you know, and letting that form whatever needs to happen. Because I think
Sure.
there's a tendency to want to think ahead, and to plan ahead and to strategize. And I suppose a lot of it's about I've forgotten the expression, but, you know, trying to prevent, you know, what we don't want to happen.
Sure. Yeah.
And that's basically MEN1 in a nutshell. It's like, how do we either delay or prevent that completely? And most people,
Exactly.
you know, understand it's, you know, it's preventable. We're not really sure. Delay, you know, can delay, yeah.
Sure.
But I think then that living in the kind of like, you know, what if, and when, takes you away from actually
Right.
what's happening now. And if what's happening now is, you know, in your case, you know, you're still young. Yes, you know, you're noticing that you're like more and more fatigued and everything, but also it's not so severe that surgery is necessarily essential right now, then
Right.
what is it that's going to kind of pull you one way or the other? And that is, in my experience, it's far easier to
Right.
hold that when you're present, when you're dealing with what you have right now.
Exactly. And so speaking about the having the second surgery, it's kind of nice to have gone through this already before. And I was worse off the first time before I had surgery. So I have at least a baseline of um, knowing what I feel like I can handle versus knowing the way that I feel now. And I'm not at that point yet. Um, and it is something that typically progresses slowly. MEN1. It's kind of like you go, and then surprise, we found something, and then you go, surprise, we found something. It's not, and for some people, it's different. Everybody's body is different. Everybody's physiology is different, but some people, things come on more rapidly, and I don't want to say some of us have it worse off than others. But there's not exactly another way to put it that way, I guess. Um, and it's funny that you talk about thinking of things that you can do to uh, prolong things or prevent things, or it's with a genetic disorder, you can't necessarily prevent things from happening, but I don't see any reason why you can't slow progression or prolong things, or um i I don't know. I have totally switched my lifestyle because of this, and I kind of look at that as a blessing. um so I'm going to jump back to I'm jumping all over the place here. um when was this? 2021. So after my initial parathyroidectomy, I had all that testing done. And I was like, oh my gosh, it's over. It's done with. I'm going to go back to normal life. I don't know about you, but my doctors here have been pretty diligent keeping up with me and monitoring things, making sure that things are not changing inside my body. I get yearly blood work. I get a yearly MRI, a yearly CAT scan. And up until December of 2021, they didn't really find anything that was changing very much. They ended up finding a what they called at that time a cyst on my pancreas, and they ended up digging deeper into that because of family history and because of MEN1 and because um, there's this risk of neuroendocrine tumors that appear in your body. Typically, I think it's the pancreas first or foremost. Um, so I went and I had a PET scan. It was a 3-hour appointment. So they use, I forget the word sometimes. It's a dotatate scan. So it goes into your body and it marks these neuroendocrine tumors, if any at all. So it's an easier way for them to um, do a scan, look at things, and say, okay, this is marking, this is marking. And so there were two spots that ended up, I believe, two spots lit up, and they kind of wanted to dig even deeper into that. And I was like, okay, so now it can get a little exhausting because I went from 17 to 18, part of the way into 19, with this one issue and dealing with all of these things, thinking about how this has affected my dad, how my grandma passed away from it. I have other relatives who had the same thing. Um, and they set me up with a surgical oncologist. She gave me some options. She strongly recommended that we go and biopsy those. And I was totally on board with that. If there's something, I don't know about you, but if there's something in my body that's not supposed to be there, I really want to know exactly what it is. And so we went ahead and did that. Um, Sometimes, unfortunately, it turns out you end up getting pancreatitis when they have to do anything to your pancreas. It's a very, very sensitive organ. So after the biopsy, about 6 hours later, I was not feeling well at all. I was not feeling better. I ended up with pancreatitis for 7 days in the hospital. So that was a pretty life-changing experience in itself for me. And it really at that point started to put things into perspective. And it was like I mentioned before, it's easy to fall into a victim mentality and a mindset where you feel sorry for yourself, and you have it so so I'm trying to think of the word, um, just very misfortuned. But I have been able to take that experience um, and really sort of turn it around and do the opposite for myself. So that was in February of 2022. So from there, I remember it was like day two of being in the hospital. This was still we still had some COVID restrictions and mandates in place. I could have one visitor for this set amount of hours during the day. I couldn't have more than one visitor, even if they weren't coming at the same time. And it was like, I'm sitting in this place, they're waking me up every 2 hours when I'm finally able to fall asleep, um, which is a good thing because they're taking care of you, they're making sure everything's okay. But it's 7 days of that is something I am going to try and avoid as best as I can. So it was exhausting. It was painful. Don't want to do that again. So I've sort of shifted into changing my diet, changing my exercise routine. And really, that's when I started most of all sort of changing my mindset and trying to put myself into a different mentality. Um, those three things together have worked absolute wonders in my life. Physically, first of all, and mentally, second of all. Um, a lot of physical ailments, I truly do believe, are not only mind over matter. I know that there's a lot more that goes into it than that. Um, but the way that you heal, the way that you recover, the way that you progress with life, a lot of that can be affected with the mind over matter mentality and positive reinforcement, and having gratuities in your life and acknowledging those things often and frequently, um, affirmations, self affirmations, positive mindset, exercise, diet, all of those things. I I've gone through all of these things. I have these two tumors on my pancreas. I've, been through all this stuff. And I, at this point, feel the best that I have, to be totally honest with you. Even before I knew that I had these things, I've, doing these things, I feel better than I did as a kid, honestly. So it's really amazing how things can change. And it's not necessarily that I'm trying to cure myself. I know that that's not really a possibility at this point with this. They're still doing a lot of research with MEN1, and with it being a genetic mutation and a genetic disorder. Um, how do you go and cure that? Typically, I don't believe that you do. So if I can do things in my life while feeling better, it's not necessarily that I forget about the things that are going on with me. I'm not ignorant to that, but um, it makes it a whole different world. It's a lot easier to go through every day, um, thinking about it less and less, and it becomes a habit and it becomes routine, and it starts becoming something that you truly do want to do. You want to eat healthier, you want to exercise, you want to have a good life, have a good day, have a good week. um, so after it becomes a habit, it kind of becomes a lifestyle, and to have adopted that, i I wish I would have done it so long ago. But that's okay, because I am where I am now, and I've done it. So I don't know if you have any similar experiences with that, but um, I figure if, like I said before, I'm not going to cure myself, clearly. But if I can prolong things, if I can um, slow any progression of anything, um, if I can stay as healthy as I can for as long as I can, I have a hard time believing anybody who's going to tell me that it's not going to help me at all, that it's not going to do anything or change anything for you. Because as far as I know, it could be slowing things, stopping things, preventing other things from happening. Because it's really a complex disease that there's still a lot to know about.
Yeah, I couldn't disagree with you on anything there. In fact, I couldn't agree with you more. Very refreshing perspective, I think, and very relatable for me to my own journey, and to, I think, a lot of MEN1 patients who are out there now and maybe battling with, what we know to be disease and what actually, managing disease could be like.
Sure.
If you want to experience that, if you want to, open your mind up to that, and, as I say, to put your focus there. So yeah, before we wrap up, I have one final question, which I normally ask
Sure.
all of my guests. If you could go back and tell your younger self one thing, what would it be?
Oh boy. It would be that, oh my gosh, so many things. I guess the main thing that I would tell myself before I found out you're talking, or sort of after, if I could go back, how far you said?
I would so if you went back to say your younger self at diagnosis, say the one who was,
Sure.
scared and uncertain and unsure.
When I felt like the world was exploding.
Yeah, that one.
Yeah. I would go back and say, well, I would tell myself to start doing what I'm doing now, for sure. As fortunate as I am in sort of an unfortunate situation, I found out super early. They've been able to watch me and monitor me from a younger age, and I do have it better off than some people in that way. But I would go back, and I would tell myself, uh, you will not regret making these changes and doing these things if you start it now. And I think that's something that could ring true to anybody with anything going on, or if you're a perfectly healthy individual, it's still something that will positively impact your life for sure. um, I would tell myself that it will be fine as well, because um, going into that pit of the unknown, and letting your anxiety and your mind kind of run and do its own thing, it's hard to stop sometimes. And fear of the unknown is just something that really sort of prohibits us from any sort of progression with anything in life if it gets bad enough. Um, so I would let myself know that it's, I'm 26 now and it's fine.
I love that. I love hearing all the different responses. And I think perhaps of everything I've heard so far, the one you've just given relates to me and my journey most. So it's kind of no wonder, no wonder that we
Right.
connected. Justin, it's been such a pleasure to chat to you, and thank you for so generously coming on and sharing, and very authentically and honestly as well. And I think that will be appreciated by anyone who's listening back. But I really look forward to, you know, keeping up with you and checking in with
Yeah,
how things are. And definitely, I feel like yours is a voice that we'll want to have around. So I can't thank you enough.
absolutely. Thank you. And I think you can agree to the point that you could probably sit down and talk about this with somebody for 12 hours at a time if you really get into it. There's so much more to be said and so much more to talk about than, you know, what we're scratching the surface with. It's really amazing.
Certainly is. We could do with a whole day, a whole day on
I
a
know. I
podcast.
could.
Maybe next time.
Yeah, yeah,
Anyway,
maybe next time.
thank you, Justin.
Absolutely. Thank you.